Hope you all have had an awesome day. Uh, Looks like everything's working okay. Hearing me, seeing me okay? I think so. I think we're good to go. While everybody's jumping on, I'm going to say my disclaimer real quick here. So anything that I say tonight is just health information and not specific health advice. Do not start taking or stop taking or change the way you're taking any of your medications. If you feel like you need to do that, please first consult with your prescribing practitioner so they can help you do that safely. There are medications that you definitely shouldn't just stop cold turkey. Um, Attending this Wellness Wednesday does not establish a doctor-patient relationship. And I think we're good to go. Hello, Bobby. Annette. All right. I think we are good to go. All right. So today, I really get a lot of questions about gut health, and I have specific questions that I'm going to go over with you tonight to basically dive real deep into this topic of gut health. So much information out there on the internet revolves around gut health. I mean, there's so many reels and videos and handouts that people are giving out. Um, it's like everybody needs to go on a probiotic, and there's all this information about gut health. And while gut health is extremely important because, and I'll explain, because it is like your body's first interface with what you're putting into it, right? Whatever you're eating, drinking, even some of what you breathe goes into your gut, and not just your lungs. So it's important to make sure that your gut is functioning properly because it is where the immune system starts. 80% of your antibodies are produced in tissue that is just underneath the lining of your intestines, called the GALT, the gastrointestinal associated lymphatic tissue, and or lymphoid tissue. And so we know how important uh, the function of our intestines is. Now, I had to laugh at this first question, so I'm going to ask this first question. And I don't know if this is Vicky, who is a patient, but Vicky asked, "I need a description of leaky gut. It's just such a gross name. My mind won't let me think about it." Yeah, okay, gut. I guess I just gloss over that, but I guess it can be kind of gross. Um, Intestines, right? Leaky intestines, permeable intestines. It's just not as fun to say. I mean, leaky gut is funner to say. Um, so what happens is, think about it like this. I'll try to give you a visual image of what leaky gut is. Picture the inside of your intestines, the lining of that tube that's about 36 feet long, right? It's long, all right? And think of it like a patchwork quilt, okay? And it's held together by those stitches. Well, sometimes those cells, those patches that make up that patchwork, get inflamed, and those cells start to shrink away, and those stitches dissolve, and you get gaps between those patches. All right. That allows for things to leak through that lining into the tissue underneath, and right there are your capillaries and veins. Those tiny venules, little tiny blood vessels, and uh, and so that's where that gastrointestinal associated lymphoid tissue is as well. So when these cells become inflamed, and that starts to separate things, and uh, and things start to leak in, that is what we call leaky gut. So increased intestinal permeability is the technical term. And things like undigested proteins, sugars, fats, can leak in there. Um, Bacteria, yeast, parasites can all go through into the bloodstream there through that permeable lining. Okay, and what happens is um, it can irritate things as they go through there. The intestinal tissue that lymphoid tissue can start to create antibodies. The immune system is alerted right away to complex with those particles, and those immune complexes, they're called, then can go through the bloodstream and be deposited anywhere, like joints, muscles. Uh, this is often described as when you have leaky gut, you also can get a leaky lungs and leaky brain, and because these, whatever causes those stitches, if you will, um, uh, those binders, and I'm actually blanking on the names of those little proteins that hold those cells together. Um, they're gap junctions or something like that. Um, they they dissolve away, and that can happen elsewhere in your body too, right? The things that cause that inflammation to happen. Guess what that does that a lot? Chemicals like glyphosate and um, other pesticides and herbicides, um, and and so uh, and many other things can cause the intestinal inflammation. So gluten that goes undigested, these undigested proteins, when you don't digest your proteins very well in your stomach. Another question that was asked. So we'll get to that. Um, how to deal with recurring acid reflux? What causes reflux? So when your stomach doesn't produce enough stomach acid, you don't digest as well. Undigested particles of food, undigested proteins, really, go into your intestines, and then those undigested proteins can't be absorbed properly through the lining of your intestines, through what we call the brush border, and they inflame the intestines, causing this problem. All right. Um, so what happens is in the stomach, you can't digest your food appropriately or properly, and because it also then starts to irritate your stomach, it's not digested properly, your stomach will churn and force that undigested, now it's more liquefied into the esophagus, and it's not pure stomach acid because you don't make enough. It's not that. It's this liquefied food that is breaking down and sometimes fermenting and turning into other acids that are not as acidic as the stomach acid, and it refluxes and it still burns into your esophagus, right? And some of you get it way up here, and you get inflammation of your oropharynx or uh, the lower part of your I'm forgetting the technical term now. The not It's the oropharynx. So part of the lower part of your mouth and your throat. So it gets inflamed, and then you make mucus. And some of you, have that mucus that you wake up with every morning because of the acid that's coming up. It's the food acid that's coming up into your esophagus. That can cause hoarseness, that can affect your vocal cords, can cause a cough, it can cause, other symptoms. So, um, and some of you end up sometimes aspirating that, and you get lung issues from this. Um, so it's not there's too much stomach acid causing that reflux. And when doctors give you one of the questions, I think I covered it in the master class or in the Q&A, but our the question is taking Protonix bad for your gut? Protonix or some other acid blocker like Prilosec or Omeprazole is the generic name for that. There's esomeprazole. There's you know other kinds of acid blockers like famotidine and ranitidine, and they block acid. These others also impair the stomach cells from making acid, proton pump inhibitors. And so now it's making the problem even worse. Now, part of that is, uh, I think one thing to kind of consider is the reason why doctors give these drugs is because they do sometimes help with the symptoms in with other mechanisms. It's not because lowering the stomach acid actually causes lessening of the acid in your, in your stomach. In a way, yes, it does decrease your stomach's ability to make that food into that liquidy, chyme it's called. Um, but it doesn't solve the problem. All right. And those drugs have long-term effects. They are not designed to be taken chronically because they really cause a decrease in magnesium, and they're linked to problems with brain function, literally linked to Alzheimer's disease. So anyway, that's what causes reflux, is when you don't make enough stomach acid. And certainly eating acidic foods could cause some of that, could make that worse. And some of you do much better. The approach to this is changing the way you eat. All right. So eating a lot of starchy foods, carbohydrates, and even dairy, which you'd think might soothe it, can aggravate it. And I can tell you that firsthand. I often thought, well, if I just drank some milk, I'd stop having the heartburn I was having. Never really did help. I thought it would, and I would try it again and again, and it just seemed to make it worse later on. It never fixed it. So that's not the answer. And the this whole thing with inflammation of the gut, this is now what leads us to a state of ill health in our intestines. All right, so that's what I want to kind of get into. When you have leaky gut and you have this inflammation, you can have symptoms or you may not. All right, sometimes this can cause um, IBS type symptoms where because you're not digesting your proteins, often your fat, you're not digesting the fat you're eating. Um, and that can be from your liver's not functioning as well either. When your stomach's not functioning to make enough acid, your liver's also probably not functioning to make enough bile, and you're not digesting fats that you're eating. And so you'll get looser stools sometimes. Or because of this inflammation, your intestinal lining cells, they're dehydrated, they're not functioning, and that also affects the colon cells. They're not able to draw enough water, or maybe they're too much, they're drawing too much, and you get constipated. So you can have various different effects. I wanted to address something that a lot of you have, which is bloating. All right. So a lot of you get this bloating sensation. and and what happens is you're feeding certain bacteria that make certain gases. By these bacteria digest the food that you're not digesting, especially like gluten or wheat, which is full of fructose, like so many other grains are. When it comes to some of the problems you ladies have with this bloating, it's these bacteria that are trying to deal with all this fructose from the grains, and you get bloated, right? You get this gas they produce. It gets, builds up and builds up and literally stretches your intestines on the inside and bloats you, right? So that's what causes this. There are other bacteria that will make different gases that can cause constipation, right? Those particular gases cause that. Other gases can cause diarrhea. So you've heard of methane gas, which can certainly lead to more problems with diarrhea. Um, and and so this bloating often goes away when you start to follow, what I recommend in the master classes, and that's to really be careful of these different foods that you're eating, grains, dairy, and some others. Certainly, sugar inflames the gut, and that's why it's well, it's hard not to eat it. Okay, I get that. But sugar will inflame the gut and cause a lot of these types of symptoms as well. And so I wanted to go from here and answer a bunch of these questions that I've compiled for, and actually thank you to um, my staff for compiling some of these. So I'm going to now switch gears to answering some questions that now you kind of have a background of what's going on with the gut and, with inflammation of your intestines. And so this is sort of a good kind of backdrop for some of these questions. So the first one is, how does standard thyroid medication, Synthroid or levothyroxine, affect gut health? And mind you, a lot of these problems where you don't produce enough stomach acid, where you don't produce enough bile in your liver, happen because of your low thyroid state. All right, these things happen because of a low thyroid state. So these affect your gut health. They should improve it, but they don't often. Some of the common side effects of these medications, these synthetic medications, are more inflammation. So stomach upset, nausea, sometimes more constipation because they're not actually helping. They're not getting absorbed properly. 80% of the time, people taking synthetic thyroid medications, they don't help. They don't get the benefit of taking these drugs. And it is thyroid replacement hormone, and people often need that. You do, but when it's not as easily absorbed or metabolized, it doesn't necessarily work very well, and so you get these symptoms more and more. Let's see. Sandy asks, Dr. Redd, can you talk about supplemental probiotics and their role in gut health? Who can benefit and who might not? And are there supplements that are better than others in general? Well, I'm going to answer that last one first, because there are better probiotics out there than others. Probiotics that are just produced by, commercial, manufacturers they're lacking, often very lacking in their, how their potency, how well they're able to help, how many strains, are you really supposed to get? So every one of our new patients, every time we accept a new patient into care, after going through their comprehensive testing, after going through giving them a comprehensive diagnosis and determining if they're accepted as a patient, they get comprehensive stool testing, because the health of your intestines in your gut is so important. It's true, but we definitely need to be very specific about how we're helping you, and not just guessing and just giving you probiotics just because that's the right thing to do. Okay, because that's what's determined to be healthy for your gut. Not everybody needs them. We do this stool testing to find out if you actually need probiotics, and you may not even need them right away. Maybe we have to start tackling other issues first. Maybe you have pathogens that you didn't know you had. And the first step is going to be to get rid of those pathogens in your gut, those bacteria that shouldn't be there, that even if they're not causing infection, they're overgrowing, and they can easily, what we call, go through a polymorphism transformation and transform into pathogens, where they start really causing more and more inflammation. So we have to get rid of them. And they are often responsible for some of the symptoms, because the overgrowth alone causes the problems with the gas and the things that they're doing to cause the bloating and all that. So it's just it's a process. It's a very distinct an ordered process, right? And so some may have a huge imbalance based on those tests, right? Some may not have as much of an imbalance as they thought they might. Some people are taking probiotics and they really shouldn't, and they have an overabundance of those types of bacteria and not enough of some of the others they need to balance things. So taking probiotics in some cases can make people worse, make your gut health worse. It's all about balance. It always is. So um, that the probiotics role is to better balance the gut imbalances, the microbiome, or let's call it the dysbiosis, right? That's the technical term that someone might be experiencing because of the wrong diet. They're feeding the wrong bacteria. And so they need to um, rebalance after it, when it's appropriate. And it may not be appropriate right after you get the test results. Okay, please understand that. It may be more appropriate to treat the other imbalances by killing off some of the unhelpful, let's say, foreign bacteria that really shouldn't be in there. And then you can focus on building up the right bacteria. So there's definitely an order to things. And okay, uh, this this question, Margarita says, I'm concerned deeply about parasites. I'm assuming in my intestines or gut-related areas. When I finally made it to the ER in December, it was after 3 days of not being able to eat without horrible repercussions. 102 fever, felt like somebody was punching me from the inside of my stomach. After taking a contrast CT, they saw nothing in my stomach, gave me an antibiotic, which seemed to help, but weeks later suffered severe relapse, and that continued a few times. So I knew something was in my intestines that was killing me or felt like it. I had a few enemas that I decided to do more thorough cleaning with a colite cleansing to get everything out of me, and left word with my GI doctor about the whole thing. He's probably the most receptive doctor I have, so I hope he'll get back to me soon. How would you feel about cleaning out your intestines like this, doctor? And am I doing the right thing? All I can say is I'm sorry that you were dealing with that. And at this point, you're still guessing because you don't have the right testing yet to look at what bacteria you actually have in your gut, especially after taking those antibiotics. And so antibiotics will clear out a lot of the helpful bacteria that you need. And that's another reason it just throws you further and further out of balance. And so you do get relapses and episodes like this. So they also can't really see viruses on scans like that. So can a virus be the problem here? Certainly it could be. Viruses can cause what we call gastroenteritis, right? It's a inflammation of the stomach and maybe the intestines, and so that can be an issue, and that's not going to be fixed with antibiotics or probiotics or anything like that. Okay, parasites. So often, so we're born with them, right? But they may start in the gut, but then they migrate out. The kinds we are born with tend to continue searching for nutrients, and they go beyond the gut, okay, into our tissues. And so we do have a problem with parasites as a human race, and we need to consider that and address it, okay, because they can have a lot of problematic effects, not just on our gut health, but everywhere else, liver especially. And Annie says, I don't have a gallbladder. This will be interesting. I wanted to highlight that because when you don't have a gallbladder, and oftentimes you gals get your gallbladders out because of inflammation, improper function of the gallbladder, stones. These are often caused by parasites. Okay, that's typically why we get gallstones and liver stones, which you can still get liver stones. And then that can lead to other problems. But there are liver flushes, but I don't recommend them unless we're already starting to take care of your gut in the right way by getting these tests And if you're a patient, I don't recommend doing a liver flush just to do a liver flush. But we've had patients do liver flushes. I had one, I know her name's Christine. She was able to clear out, I mean, every time she did a flush, she was clearing out literally hundreds of small stones. And these were coming from the liver. And this has in the long run helped her who has been dealing with all kinds of chronic issues, and little by little they're getting better. It's like an onion peeling the layers of the onion away. She is getting better and better as she peels these layers away. That was a big one, right? Trying to get her liver to function better for her, and getting these stones out was a big help. But literally 4 or 5 flushes each time yielded several hundred stones. All right. I know it's hard to believe. Shelley asks, I learned that the order of eating is veggies first, next protein, then starch. My question is, where in this scheme do we eat fruit? I don't always eat fruit, but on occasion I will have some berries. Okay. Fruit is high in fructose. Typically, there are some fruits that are low in fructose. And I don't usually include fruit in that order of eating because fruit is not generally necessary. It's good, they're good, but not necessary, especially when you're trying to heal, when you have a blood sugar problem. Fruit isn't necessarily a part of your everyday regimen, diet. And if you're going to have any fruit, it's always as a snack alone, or you can add a little citrus to like your salad with your greens to help absorb iron better if you need to have more iron. Citrus enhances, the ascorbic acid enhances your absorption of iron. So maybe a little lemon juice, right? Or a few little mandarin orange slices, but that's the only time maybe some berries in like chia seed pudding. They're so low in fructose that they're probably okay to eat like that. But if it's going to be like an apple or a half a banana or something like that, again, depending on your goals and depending on whether you have a fructose problem, those higher fructose fruits they definitely should be eaten away from everything else, like as a snack, a standalone snack. Okay. So Nancy's trying to heal with gastroparesis. And, there are multiple causes of gastroparesis. One of the major issues is these GLP-1 drugs, GLP-1 agonist drugs that cause it. Low thyroid certainly can cause gastroparesis. Insulin resistance and diabetes can cause gastroparesis. So it depends on the underlying causes. And when you can reverse those, get this, if it's low thyroid, get it better balanced, get control of whether it's autoimmune driven hypothyroidism, then that's going to make this, easier to see if that's going to heal or not, because sometimes those nerves, I mean, they just take so long to heal, and it's a nerve, nervous system, nervous tissue issue causing the problem with moving your bowels and your intestines appropriately, moving your stomach appropriately. Helen asks, I have a question on electrolytes. I looked at the ingredient listing for the one I'm currently using. It contains organic stevia leaf extract. Could you recommend any electrolytes that don't contain sugar alcohols, or other sweeteners like this? There's one called ProMix that is unsweetened, or you can just use pink salt. Redmond's or there's some others. Himalayan pink salt. Those are okay. Glenna, does grass-fed collagen help a 77-year-old as well as Rise Mushroom Coffee? Been taking for 6 months plus Ozempic. So part of the issue is the Ozempic is going to slow your gut down. It's going to really impair your gut health. That is not something I recommend. I know I can't give recommendations, but I would not recommend it for anybody, especially if gut health is an issue for you. I'm not a huge fan of the Rise Mushroom Coffee brand, but there are some other brands that are okay. Um, you know, Caffeine does help move the bowels, and sometimes that's appropriate, but sometimes it's not because it can raise your blood sugars. So I can't really give any blanket recommendations, but it may not be. And grass-fed collagen, your body has to break it down. It has to form, break it down and then form collagen on its own. And that means you have to be able to digest it and reform it, rebuild it. And you have to have, good absorption in your gut. So if you are dealing with poor gut health and you're not noticing any benefit from that, that's why. All right. Brandy asks if my blood sugar and A1C are both in normal range, but below the optimal range, and fatigue is an issue for me. Are there eating habits I can change to slightly increase those numbers to optimal range? Anyone with low normal blood sugars, um, A1C and blood sugar, uh, probably does need you probably do need to change your eating habits. You'll need to make sure to get at least 3 meals a day, and you don't have to eat carbs to get your sugars regulated. You just need to eat 3 meals a day with protein and vegetables and healthy fats. Like I said, the occasional fruit snack uh, by itself could be okay, barring any sensitivities you have to any of those foods. Michelle asks, do you have gut health probiotics and prebiotic recommendations? Um, like I said, I hesitate to give any recommendations for anybody to take pro or prebiotics because you need to know what's going on in your gut first. So, I mean, prebiotics, let's define that since we haven't talked much about prebiotics. These are certain foods that give the right gut bacteria the food they need to, so you can cultivate them so they stay. Because you can take probiotics, in other words, supply your gut with these bacteria, and then if you don't feed them or nourish them, they won't stay. You will literally excrete them and they're gone, and it's like you never took anything. So sometimes it's best when you do take probiotics to take prebiotic fiber. That's why vegetables are so important. Foods like fermented foods, sauerkraut, pickles, olives are really helpful. But this is why that's important to have those together when you need them. Okay. And uh, I mean, you can guess, but that's on you. Okay. All right. Stephanie asks, can taking supplements such as probiotics and digestive enzymes be effective in nutrient absorption and help with overall gut health? So I've already answered that as far as overall gut health, but the question I want to focus here on, the part of the question is digestive enzymes. There are some really good digestive enzymes out there, and there's some really poor ones, and I typically just recommend the ones that you can get prescribed through practitioners from reputable brands when you need enzymes. And again, stool testing helps us to see, well, there are some blood test things we can notice in blood testing and in the stool testing that can show us whether you have undigested fats or undigested protein products in your stool, which helps us to know whether you need more enzyme support for digesting your food. All right. There are a couple of unrelated questions that I will get to that someone has asked. Okay. And Sandy, hi Sandy. How do you know if you have a food allergy that comes up long after the elimination portion and using the monitor? Well, you also can have certain symptoms, and you can ask your coach about those symptoms as well, your provider. Checking your pulse before and after eating. If there's a change in your pulse after eating that food to a certain degree can alert you if you don't have any other noticeable symptoms. And what are the blood tests that show undigested protein? when you see a calcium phosphorus ratio that's high, indicating you don't make enough stomach acid, right? Then I know you're not digesting your protein well. And then can you please tell me what causes high MCH? MCH is mean corpuscular hemoglobin, and this is low, typically low iron that causes high MCH, excuse me, low vitamin B12. All right, low levels of vitamin B12 causes that, and certainly folic acid can play a role in that as well. Dr. Redd, do you see the problem with hypothyroidism or Hashimoto's disease as a problem with the cellular receptors being blocked somehow so that T3 cannot get into the cell? Also, some of the research I've come across with problems with testosterone could possibly cause reverse T3 to emerge and literally take the place of T3, but with no effect like being a blank. Let me address the questions longer, but I'm going to address those too. Receptors for T3 are actually inside the cell in the nucleus, at the DNA level. All right. So the only thing that really blocks T3 from being absorbed is inflammation, where when you have a lot of that inflammation because of toxins and your brain wants to keep those cells from dying, they don't allow T3 to be absorbed. It doesn't allow T3 to be absorbed into those cells, and it can't really then bind to the receptor in the nucleus of the cell. As far as testosterone causing reverse T3, it's usually stress, and stress can be caused by anything that triggers your immune system. Elevated testosterone certainly can trigger the immune system, as well as other hormone surges. Remember, insulin surges. Things like estrogen dominance can cause that as well. But there may be some, we're always researching this, and we'll have to see what comes of that research. The next part is, obviously this would be one means of T3 not getting into the cell through the receptor. It's not through the receptors. T3 can get into the cell, but it may also not bind to its receptor, which is kind of like a key in a lock kind of a thing. If you don't have enough vitamin D, if you don't have enough methylators, that key's not turning in that lock. All right, it's not going to turn the cell metabolism on, and so there's several factors along with that that our brain is in control of as well when we're inflamed. And she says, could this be harmful to the mitochondria, just damaging the cells so they can't receive the T3? So again, T3 binds to the DNA receptor. That doesn't allow mitochondria to turn the motors on. And then they don't produce the energy that they need to. And that's why she says her hair is falling out. And it may or may not be kind of that female pattern of balding, not male pattern, but female pattern balding. It may not be that. It may also be a blood sugar issue. Comprehensive testing is absolutely essential for you, Lynn, to get to the bottom of that. All right. Tanya asks, when referring to exercise and not doing hard cardio because it can actually work against you by releasing too much cortisol, how much of an increase in the glucose monitor would show? How many points is too much to show you've overexerted? Any rise, really. I mean, if it goes, okay, there's some variability, but I would say anywhere from at least 5 or 10 points higher, it's going to be because of a little too much stress on your body. And that cortisol, because sometimes when you're stressed, the cortisol may not rise as much as it would in normal people, but yours can't really rise too much because your adrenals are shot. And so that may not be a good measure at all. It may just be that you're tired, more tired. So I wouldn't necessarily go by what the glucose monitor shows necessarily with exercise, but you can, especially if it goes up a lot, then you'll know for sure, like, oh my goodness, that exercise routine was way too hard. right? So that's that's really important. Okay. Let me see if I have any other questions. Okay. So, lots of good questions. All right. Is constant constipation a factor that can be healed in the program? Absolutely. Can bladder infections be the result of a leaky gut? Um, Again, when I said that when you have leaky gut, you can have other things leaky. I don't know that that's necessarily going to be, I mean, I would say maybe yeast infections, okay? Um, that could be a cause of, you know, bladder infections that aren't necessarily bacterial. And that's where you can get yeast causing, urinary urgency. Um, but again, it just depends on how they've been able to test that and if that is something that grows in the urine culture. Bobby asks, can the body heal to start to make the needed stomach acids to digest food properly? Well, yeah, I that is absolutely the case. And um, it's one of the earlier symptoms of hypothyroidism, but it can, yeah, I've had a lot of patients be able to really start to do better and they don't necessarily need the enzymes. Yeah, actually, one in particular, her name's uh, Christine. Um, Definitely doesn't need. She used to take a lot of HCl and digestive enzymes, and she just doesn't seem to need it as much anymore. Ruth asks, can a person somehow heal a small hiatal hernia? Um, I'm not sure that that's something that's more of a structural issue. I'm not sure that someone could, uh, by doing anything in particular. I don't know. I don't know of any way to do that. Annie asks, I've been having problems with taking the ACV or the apple cider vinegar. I get a lot of burning and get nauseated, probably acid reflux. Well, it's because your stomach needs to make more of the protective lining, the mucus lining. And so for you, maybe taking the apple cider vinegar isn't the greatest idea. And you would need more soothers. Try aloe vera juice. Someone that has these issues would probably do better to do uh, aloe vera juice on an empty stomach, every day for a couple of months. Um, the capsules will not work the same because the idea is it has to help with the acidity in the stomach to help turn on your digestive enzymes to digest your protein better. And when that's the goal, capsules will not work. All right. Agnes says, I get bloated after drinking lemon water, which is sad since lemon water is good for you in the morning. Well, it might not be good for you. Maybe some of that kind of same thing is happening. It's maybe not the right thing for you to do, and you need to get to the bottom of that. And comprehensive testing is going to be the key for you gals who are, you're not benefiting from some of the tips and tricks that I've given you. Again, when I give you tips and tricks, you know, maybe most people are able to utilize them and benefit from, but there are going to be some of you who don't. And you'll know for sure that you need comprehensive testing to get to the bottom of that issue, right? And since gut health is so important for overall healing, and putting autoimmunity into remission, and that's the bottom line here, ladies. It's like getting your gut to heal is absolutely essential for getting Hashimoto's and other autoimmunity into remission. All right, it is the key. So that's why this discussion is so important. And I just have a couple minutes left. Um, Janine asked about MP thyroid. Is it more effective than synthetic thyroid? It really depends. It might be better tolerated, better absorbed, but again, it's a very individual thing. Is armor less synthetic? Well, yeah, it's derived from porcine thyroid or pig thyroid. Um, so no berries at night with a little yogurt. I don't suggest anything at night anyway, because you're trying to fix, most people are trying to fix a blood sugar issue, and eating at night is not going to be helpful. Um, unless it's something that you've worked out with your provider and they said maybe in your case that might be helpful for you. I would not typically do, and hopefully the yogurt's not dairy. So if it's non-dairy yogurt, it does have a little protein, maybe from coconut or from, almond milk, something like that. So if you've been told that that's all right, eating some berries with that is probably not the biggest issue. Um, it's higher fructose fruit with protein that is not going to be helpful. Berries have very little fructose, and so that is probably okay. But again, it may not be. That is definitely more of a, and I know you're working with somebody, so that may be something that you've been told is okay for you. Go with that, but this is not something I recommend generally. Um, Miriam asks how to use pink salt, and actually, I'm gonna skip that. That's a raw vegetable's okay. They can be, and they should be, but sometimes they're not. Sometimes people have such inflammation in their intestines that they can't tolerate that raw vegetable. They can't really deal with it. And so you might do better with lightly cooked or steamed or sauteed or roasted vegetables. Okay. Can the olives be ripe olives? I mean, yeah, yes. All right, I'm trying to weed through these for gut questions. Digesting protein well, do you suggest cutting the meat small? Yes, that's a great point. Cut it small, chew it really well, like pulverize it before you swallow it. That is, be intentional with your eating. Don't sit down and rush. Don't rush through your food. Eat it with intention on digestion. Okay? Chew your food, like mom used to tell you, right? um, or marinating. Yeah, I mean, that can help, right? That can help. Or one-to-one volume of vegetables, not one-to-one. It's more like, you got to have a lot more vegetables than you do meat in a given setting. Okay. Um, Lots of great questions. Is a little ginger okay daily? Maybe. Might be okay for you. A little ginger tea. Um, and Lisa, we'll end with this. I've had constant burping for a year now. What to stop? So in the master classes that I give, I give you a lot of helpful tips and tricks and talk about foods that you should avoid, foods that cause a lot of inflammation. And certainly, you start with foods that you eat a lot of. All right. You need to eliminate those foods. If you eat a lot of them, like maybe especially on a daily basis, eliminate those, right? Eliminate those first. Those need to go because eating foods every day causes sensitivities to develop, especially if you have underlying toxins like mold toxicity. So, ladies, that's going to wrap it up tonight. Thanks for joining me for this Wellness Wednesday on gut health. It's so important. This gut health issue is so very important for your healing. And that's why we really make it a priority. It's one of the first tests we do when you become a patient. And we really dive into that. That's part of clearing your metabolic pathways so that you can then open up your detox pathways, which are involving your gut. Ladies, have a great night. Remember, you still have the power to heal. Have hope that you still have the power to heal. Okay? And have a great night, and we'll see you soon. Take care.